Thank you for coming in. And also coming up this morning, I want to talk to you a little bit about our program today. It is our monthly commitment to C.H.I.C, the Community Health Improvement Council. We'll be talking about breastfeeding. That's the focus this morning. August is World Breastfeeding Month. We'll talk more about that and much, much more coming up this morning in the next few moments with my guests right here on KSJE. Later on this hour, of course, as we do on Tuesdays, we'll be checking in with Amber Francisco from the Farmington Regional Animal Shelter. She'll be telling us about some of the pets that are available for adoption this week, including, look at that kitten on the screen right there. That's Carrot. Carrot is available for adoption. You'll learn more about Carrot coming up today at 8:50 a.m. on KSJE. Usually I tell you about Mick Hess and Roving with the Arts. Mick is taking a couple of weeks off during the month of July, so Peter Vandegraff will be filling in for Mick at 9:06 this morning on KSJE. And then later on this evening, we want to remind you it is city tournament time for the Connie Mack World Series. The games begin tonight to determine who will be the host team of the Connie Mack World Series, and so we will have all the coverage live, of course, right here on KSJE, beginning with the pregame show at 5:05 p.m. So we hope you'll join us for the first game, and then, of course, the second game coming up this evening as well at 7:05 p.m. The Connie Mack World Series City Tournament coming up today on KSJE. Don't forget, you can also connect with us on our Instagram page in addition to Facebook and YouTube and Twitter. And if you're a podcast person, you can subscribe to KSJE's podcast wherever you listen to podcasts and maybe discover a program that you haven't heard before. So check it out. Outside of our studios here at San Juan College, as we take a look at our weather cam picture this morning, it is currently 69 degrees at the moment. Cloudy skies outside San Juan College, and it feels like 69 degrees. The winds are about 10 miles per hour so far, and the forecast, we are expecting mostly cloudy skies this morning, becoming partly sunny this afternoon. There's still a chance of an isolated and scattered shower today, about a 50% chance of rain. 83 for a high today in Farmington, 62 overnight with scattered showers still in the forecast. Less rain then for the rest of this week. Take a look. Partly sunny skies tomorrow, the high 87 on Wednesday, 92 on Thursday. The heat comes back for Friday and Saturday and Sunday, and even Monday with highs at 95, mid-90s, and overnight lows near 70 degrees. Well, let me get to my guests who are here with me this morning, as I mentioned, representing C.H.I.C, the Community Health Improvement Council here of San Juan County. Pip Howard is back with us. She is with the Firstborn program here in San Juan County of Northwest New Mexico. Welcome back, and good to have you with us. Good morning.
Good morning, Scott.
Thank you for being here. Also, Mariana Kleiner-Childers is joining us this morning. She is part of the New Mexico Breastfeeding Task Force. Good morning to you.
Good morning, Scott. Hi, Pip.
Thank you both for being with us. And let's talk a little bit about the efforts in New Mexico about breastfeeding. Pip Howard, I know you and I have talked about this a number of times, and this kind of gets us ready in advance of August, which is World Breastfeeding Month, correct?
Well, it's World Breastfeeding Week is the very first week of August,
okay,
from the 1st to the 7th. And then the whole month is National Breastfeeding Month with a different theme each week.
Got you. Thank you. I knew I would mess that up. I'm glad that you were trying to remind me before we came on there, and I still messed it up. But it's an important thing. And, of course, we've heard a lot about breastfeeding and formula recently because of the shortages of infant formula that have been reported around the country. And so, Mariana, let me ask you about that in New Mexico. Are we seeing the shortages here as well?
We definitely are. Here in New Mexico with the Breastfeeding Task Force, we have put together some suggestions to be helpful for families who are seeking formula. I believe we shared with you some do's and don'ts that we've put together.
You sure did. There they are. Mm-hmm. Exactly. And so what are some of the things that folks should do if they are not finding the formula that they normally would buy for their infant?
We definitely recommend seeking out help from your child's pediatrician or possibly WIC offices, and those folks who can help you find a different source. We recommend, if you're looking online, to look for reputable companies and pharmacies as opposed to buying from individual sellers like on eBay, to make sure that you're buying safe infant breast milk substitutes.
Okay. I see one of the things is, again, right, checking with your pediatrician, one of the don'ts is don't water down formula that you might still have. That probably isn't very effective, right, and very good.
Definitely. If you're watering down any type of infant supplement, you're not getting that same nutrition. So it can be dangerous. You're not getting those same nutrients for your baby.
Right. And a make your own recipe, that's a don't as well.
Definitely. Again, that's you cannot guarantee the safety and the nutritional contents when you're making it yourself, unless you're a nutritionist.
Yeah.
But I don't have.
Not many of us
I
are.
don't have those credentials.
Right, understood. And another do is to maybe switch brands, and that is okay if it's an FDA approved baby formula, and maybe switching brands that are more plentiful temporarily would be a good solution.
Yeah, that's definitely an option.
Gotcha. Some other ones on the list, social media groups, they can be helpful. That's refreshing.
Actually, here in New Mexico, there are some groups you can find on social media for human milk sharing as well. So I've seen on Facebook, like on the marketplace, people sending pictures of, this brand's available here, or I have some extra. And so people are really helping out because it's important to make sure babies are fed, which is wonderful.
Right, right. That's great. Of course, I guess, again, the Facebook group has to be reputable, and you've got to be able to kind of trust those sources in that group.
Definitely.
Yeah. Another
But
don't. Go ahead. I'm sorry.
I was just going to say it's a level of personal risk that you've got to make your best decision for you and your family.
Right, right. Another don't switch to toddler formula because that's not recommended for infants, so that wouldn't be a good idea.
Right. So with all of these don'ts, it kind of highlights why having the supports for breastfeeding is so important, because if you are able to successfully breastfeed, your breast milk is changing with your baby and those nutritional needs are being met at every stage. You don't have to worry about switching brands or different types.
True, very true. And the other do is to purchase formula online, which we've talked about. And the final don't, I think on the list is don't substitute with cow milk, because that is certainly not recommended for kids under 6 months, it says.
Yeah, absolutely. We definitely don't recommend anything besides breast milk or infant milk substitute for babies 6 months and under.
Right. And there are some other resources that are available, including from your organization, the task force, the New Mexico Task Force?
Yeah, if you go to the New Mexico Breastfeeding Task Force website, which is breastfeedingnm.org, we have a resources tab, and it can help you find connections to all kinds of support throughout the state.
Very good. Well, thank you for sharing those do's and don'ts with us this morning. I know, again, even though this was in the news a few weeks ago, I think, as you said, it's still an issue across our state and across the country of these shortages as factories are trying to ramp back up to meet the demand. And Pip Howard, let me go back to you and talk to you a little bit. And as Mariana mentioned, of course, if you're providing breast milk for your baby, you don't have to be as concerned about the formula shortage. But again, as you and I were talking about before we came on the air this morning, if moms maybe aren't producing enough breast milk or there's some other issues, they may still have a little bit of this exposure to this problem, correct?
That is correct. And, there is breastfeeding support available. We recently started a local support group too, which Mariana has been extremely instrumental in. And that is on, I believe it's the third Thursday at 10 a.m. at the Children's Museum. But I personally also provide online breastfeeding support. And all pediatricians who are seeing young babies do regular visits with them and weight checks to make sure they're gaining weight adequately, because this can be an indicator of if a baby is not gaining enough weight. It's possible that the mother doesn't have enough milk, and that sometimes getting extra support can be very helpful. Maybe it's a small problem, a small difficulty that we can help her fix. Another resource also is if a mom is wondering if she would be eligible for WIC, she can always contact WIC here in New Mexico. It's nmwic.org to see if her income level qualifies her for WIC, because I do believe that WIC in many instances does still have some formula available.
Very good. And talk to me a bit about this event you're doing at the museum, the Children's Museum, of course. This is relatively a new local time to gather and meet together.
This is, in fact, Mariana is the one who created this event, and we're going to be meeting the third Thursday at 10 o'clock in the morning at the Children's Museum, and it's called Milk and Cookies. And so, yes, there you go, Milk and Cookies Meetup. And this is in-person gathering for breastfeeding support for families. It can even be someone who's thinking of having a baby or who is pregnant, who wants to know a little bit more about our local support. Because, of course, Mariana and I are both based here in the Four Corners area. And both through Firstborn, I work as a childbirth educator, but also lactation consultant. And I can do Zoom support for moms who are having any difficulty. And I also, in my classes, I have a whole class dedicated to lactation and what to expect in that first, going through pregnancy and in that early days after the baby is born, because that is often when it is really crucial for moms to seek support if they are having any difficulties with breastfeeding in those first weeks.
Right, very true. Mariana, talk to me a little bit about the idea behind this meetup with Milk and Cookies at the museum. But this is a, as you said, monthly gathering. It's a free event for moms and potential moms to attend. And give us some more details about it.
Yeah, so Milk and Cookies is an idea I had when I started the Breastfeeding Support Club at San Juan College when I was a student there, actually. So we used to have a student club at San Juan College called Students Supporting Breastfeeding Families, and we helped to ensure that we were able to get lactation spaces throughout campus designated and help share that information with students who are also parents. And one of the things I wanted to do to bring parents together and offer support was just like, let's have a monthly meeting where we eat cookies and hang out. So that was in 2019. So of course, before the pandemic. And now that we are kind of getting back to being able to do things in person, we have been talking amongst ourselves at our Four Corners breastfeeding chapter about how we'd like to start having meetings and support groups for moms again. We used to have a really strong in-person group of breastfeeding families before the pandemic, and it's kind of died out, and we would love to revitalize that and bring back that strong community support. So I am starting with open free events at the Children's Museum from 10 to 11 on the third Thursdays. And I show up right now with lots of resources and information about where you can go for help and different breastfeeding information for those expecting parents and newly breastfeeding parents. And we are hoping to recruit and find other parents who want to connect and get together and support each other.
Very good. Well, the next meeting is coming up this month, of course, July 21st, right? 10 to 11 a.m. at the Children's Museum, which for our radio audience is located at 302 North Orchard Avenue in Farmington. And it's a free event, as you mentioned.
That's correct.
Very, very good. And so what type of questions do you get, Mariana, at the task force from maybe new moms? Are they, and as Pip mentioned, it's so important, I guess, to, get breastfeeding going in those first early days, right, after the birth of a child. Is that one of the biggest concerns or questions that new moms are coming to you with, or what are they asking you?
Well, for me, as an outreach specialist, my main focus is helping families and employers when on their return to work or to school, actually.
I see.
So I don't deal a lot with the lactation part itself. I'm not a lactation counselor, but I help parents when they're going back to work and they need to talk to their boss about having flexible break time and a private place to express milk when they return to work. Or maybe they need to switch their schedule a little bit or take on a different position so that they can be both taking care of their baby's needs and meeting their duties at work. So
understood. And are the employers fairly open to those conversations that you have with them?
The employers that I get to speak to, yes, they are usually looking for ways to be compliant with the law and make sure that they're providing good accommodations for their employees. Um, in New Mexico, we have two separate laws that cover all employees. You might have heard that through federal law, there are 9 million women in America who are not covered to take break time when they return to work. But in New Mexico, that's not the case. In New Mexico, every employee has the right to flexible break time in a private place for as long as they can decide they want to continue breastfeeding.
Very good. And a good reminder. And I imagine if women aren't finding that their employers are that flexible, maybe the employers need to be reminded of these state laws that are in place.
Yeah, and at the task force, our role is really, we want to be collaborative. We want to come in and help and find a good solution. It doesn't have to be a permanent solution. A lot of employers don't have or haven't dealt with employees who need this accommodation for a long time. And the great thing is it doesn't have to be permanent. It just needs to be accessible as long as that parent needs it.
I understand. Let me pose my original question back to Pip Howard, who is a lactation consultant, and maybe she can provide us with a little bit of insight as to the questions that new moms are maybe bringing to you, Pip Howard, when they ask you for some assistance.
So a lot of the questions are about, am I making enough milk?
Mm-hmm.
And then some of the other questions is, how often should my baby breastfeed? And as you mentioned, really critical support is important from the moment of birth. And the parents being knowledgeable before the birth is also really important. And that's why I teach prenatal breastfeeding classes. And while I teach those about every 6 weeks or so, I'm also available if someone has questions. Either parent can ask questions, because sometimes we'll get questions from the other parent, the non-birthing parent, about what can I do to help? Because a lot of the time people think, oh, well, if I can give the baby a bottle, then I can participate in the feeding. But in those very early days, in that first month of the baby's life, we don't recommend, unless the mom is having to go back to work, we don't recommend adding bottles right away. We recommend that the baby learn to breastfeed really well and that the parent understand what to expect. Because it is, we don't necessarily see in our everyday lives, we don't necessarily see babies breastfeeding. And so knowing what to expect in those first days or those first hours, because the general recommendation is that every baby gets placed skin to skin with their mother shortly after birth or immediately after birth. And by skin to skin, what I mean is after the baby is born, the baby is then immediately placed on the chest of the person that just birthed them, so that they are allowed to spend that time. And what I'll say to parents often is that put yourself for a moment in the baby's shoes, as it were. Not that newborns have shoes, but that you put the baby directly on the mother. And that is a very reassuring location for the baby. Because, historically in a hospital, we would take babies from the mothers and examine them and weigh them, and all kinds of things would happen. But ideally, that newborn should be placed immediately in direct skin to skin contact. And that is one of the foundations of how babies can thrive, because it's very, very reassuring to them.
And that is somewhat of a relatively, maybe new concept, Pip Howard. I think we've been doing this for several years, of course, but we've all seen the movies, right, where you have the nurseries in the hospitals and the babies are in the little bassinets and they're all lined up in nice even rows and things along that line. That's the old style of babies being born type of thing, isn't it? And the new is to keep the baby with the parents.
Yes, it's the old style. Yes, it's the new style, but it's also the old style.
Okay.
Because if you go back further into history, when babies were still born at home, so for instance,
right,
in the 19th century, before babies were mostly born in hospitals, they would have stayed with the mom. But yes, in the last 10, 15 years, we have really made a big move to keeping babies with the mother in the room, because that's baby's natural habitat. The baby has been used to being with the mom throughout the pregnancy, and that's where the baby feels the most secure, the most comfortable, and the least stressed. And it's also the least stressful for the parent, because when you consider that a full-term baby is born after approximately 9 months of gestation, they would then, the baby has been gestating inside the parent and is very familiar with the heartbeat, the sound of the voice, with the smell, the taste of the parent. And so in those first minutes, allowing the baby to remain close to the parent is definitely the optimal situation for the baby, the best way to get baby breastfeeding, and then how best for the parents to learn to care for that child, but to have them in the room with them the whole time.
Very, very good point. Thank you for that. And Mariana, let me turn back to you about the work of the New Mexico Breastfeeding Task Force. And again, I think it's part of your job to ensure that new moms and reoccurring moms and moms that have had multiple children are aware of the services that you provide, and working in communities across the state, including here in Farmington and in San Juan County, and making sure moms know about the services that are available.
Yeah, absolutely. I get to do community outreach as part of my job. So I get to show up at these local events, conferences, and I'm available for any mom to reach out if you have any questions, or family members if you have questions on how best to support your new breastfeeding family members. In New Mexico, we actually have a really high initiation rate of breastfeeding. Over 86% of families in New Mexico initiate breastfeeding and start out that way, and that's what their feeding plan. However, at 6 months, only 26% are still exclusively breastfeeding, which the American Academy of Pediatrics, the World Health Organization, all of these major health associations that we look to for guidance recommend exclusive breastfeeding for 6 months and then beyond, as long as the family is comfortable. The American Academy of Pediatrics last week actually released new recommendations for feeding up to 2 years, as long as everyone is comfortable with that. So we have a huge disparity in what families want to do and what they're able to do. And the mission of the Breastfeeding Task Force is to help fill in those gaps and find out where the struggles are and how can we fix that. We have a lot of really amazing ways that we're reaching out to communities to do that. So we have our employers that we reach out to. We do presentations for any employer who's interested in training their staff on how to be accommodating, how to make their workplace breastfeeding friendly. We do trainings with pediatricians and healthcare professionals so they are up to date on the best lactation education that there is. We reach out in a lot of different ways, and we're always looking for more ways to collaborate and bring it to the forefront.
Right. We're showing the graphic about the work that you all do at the task force, of course, and I was surprised with that statistic. About 26.6% of babies in New Mexico are exclusively breastfed at 6 months, and that's down from what you said earlier when they're first born at maybe more than 80%. Correct?
Absolutely.
Yeah.
We see a lot of that. If you get that breastfeeding going strong in those early first months, but when moms have to return to work, usually at about 12 weeks or 3 months, we see a really big decline in exclusive breastfeeding, because many mothers in New Mexico they don't feel comfortable standing up and asking for their accommodations to make breastfeeding work. And so we want to build those supportive environments where it doesn't feel like it's so hard to ask for. It shouldn't be. It should be ready for them, but we're working on it.
Right. Very good. Well, good for you and good for the work that you are doing. Pip Howard, I know there are some other efforts underway locally too to help moms, and the Harvest Food Hub is part of that, maybe a possible solution. Can you tell us a little bit about that idea?
So what is happening is they're investigating the possibility of becoming a milk depot. So that would mean that people could donate milk locally, and it would then be transported to the New Mexico Human Milk Repository in Albuquerque and be made available. So that is one. It's not for sure yet, but they're working very hard on it to see if we can have a milk storage area there. Another thing that the task force is doing too is training certified lactation counselors. Now, a certified lactation counselor is a very nationally recognized standard, and the New Mexico Breastfeeding Task Force is sponsoring approximately 25, I think it is, individuals every year to take this training and giving them support throughout the training so that there are more certified lactation counselors available in all communities. They're especially focusing in communities that are lacking in other breastfeeding resources, because often people will look for advice maybe from a pediatrician, and the pediatrician's primary focus is the overall health of the baby. Is the baby gaining enough weight is often one of those big questions. And they may not have the time to offer breastfeeding support. The simple solution can sometimes be seen as, well, why not add formula? Whereas if a person can receive good breastfeeding support, then they're more likely to succeed with breastfeeding and delay the need for formula.
Understood. And I just wanted to go over, before we run out of time this morning, the data behind our conversation this morning, because it's been well proven. And Pip Howard, I think you and I have talked about this on multiple occasions, as I've said, about the quality and the importance of breast milk for babies as opposed to formula. Breast milk has been proven to be but very helpful for the development of these babies, correct?
That is correct. And the thing about human milk, the direct conversation, as it were, between a mom and a newborn is that there's a communication, and that human milk has very large amounts of antibodies, which helps with many aspects of not only the baby's health, but also for the mother, because that person who has just grown and gestated that baby, she also will benefit from the act of giving her milk to the baby. There are proven benefits not only for that newborn, but also for the parent who is able to provide that milk. There are less instances of certain types of cancers. There are less instances of diabetes, especially for those moms who maybe have had gestational diabetes. If they are able to breastfeed during the immediate postpartum period, that can help reduce their risk of getting type 2 diabetes later on. So there are health benefits on both sides of this equation. And while formula provides adequate calories, it doesn't adapt in the same way. And I know Mariana mentioned this earlier, that breast milk adapts over time. It starts off with a newborn, has a very, very small stomach, about the size of a cherry. So in the first day of life, a newborn only needs about a teaspoon per feed, but very quickly in that first week of life, the baby's stomach grows. And if the baby feeds often, that baby should be feeding a minimum of 8 times a day, around the clock, in that first week of life. And if the baby does that, then that induces a right amount of milk in most cases, that the mother is able to produce enough milk for her baby, and she sees her supply grow extremely quickly in the first week of that child's life.
Pretty good design, it sounds like to me.
It is a pretty good design.
Yeah, very good. Pip Howard, before we run out of time, if folks would like more information about your program, the Firstborn program of Northwest New Mexico, and all the services that you provide, how can they reach out to you? What's the best way?
Well, they can reach me at pip@nwnm, as in Northwest New Mexico, firstborn.org. If they have breastfeeding questions, I'm also pip@breastfeedingnm.org. You can look up the Northwest New Mexico Firstborn program. We have a Facebook page, and they can reach me by phone at 505-486-0120, and that does directly go to me.
All right, very good. Thank you very much. And Mariana, can you remind us how we can reach you at the New Mexico Breastfeeding Task Force?
Absolutely. My email address is mariana@breastfeedingnm.org.
All right, very good. Thank you both for being with me this morning. I appreciate both of you for joining me and the information that you've shared with our audiences today. Thank you very much.
Thank you, Scott.
Thank you, Scott.
Thank you both. My guest this morning here on KSJE. KSJE is supported by the San Juan County Historical Society, presenting the film Rambo of the Caracas Mesa, A History of Jicarilla Mustangs, with a premiere on Saturday, July 16th at 6:30 p.m. at the Farmington Civic Center, followed by a gala with the stars. Tickets are $18 and $25. Find out more at fmtn.org/shows. The San Juan County Historical Society. Are you looking for a career in education, school transportation, student nutrition, or grounds and maintenance? The Bloomfield School District has competitive wages, benefits including paid vacation, sick leave, paid holidays, and a retirement package. Find out more about all the available positions online or from Mike Sturdivant at 505-632-4326. Bloomfield School District, investing in our future. Bloomfield School District is an equal opportunity employer. KSJE and San Juan College present the Student Success Coaching Tip of the Week.
Hello again, this is Evan Chi with the Student Achievement Center, bringing you your college tips over the radio for week 5, learning new information. Within this, students will learn new ideas by relating them to what they have already known and then transferring them into their long-term memory. Studying starts in the classroom. Pay attention and take good notes. So when you're studying later, you're just reviewing information, not learning it for the first time. Whenever you're using a notebook, a laptop, or good old-fashioned flashcards, reviewing each line of your notes helps ensure that you will hit all the right information you received in class and might even remind you of a few things you would have missed otherwise. It's good to review notes shortly after class and then again a few days later. This allows you to take a break between edits and come back to the information with a fresh perspective. One of the study tips for college that can make a massive difference in how you approach new information is knowing the difference between memorizing the material and understanding it. Memorizing information isn't actually learning the information. It's just helping you learn how to repeat it during a finite time.
The Student Success Coaching Tip of the Week, presented by KSJE and the Student Achievement Center at San Juan College.
Your credit score can